By Dr. Chris Walensky, DDS, Medical Director at WaterLase, to learn about their amazing WaterLase technology. Welcome, Dr. Walensky.
Thank you so much, Jackie. Thanks for having me.
Can you tell us how WaterLase came up with this breakthrough technology?
Sure. The founder of the company was actually a dentist, and he discovered that by combining this unique wavelength of laser energy with water, the water would get energized and was able to cut tooth structure and gum tissue a lot safer and a lot more comfortable for patient experiences. And now here we are 25 years later, and WaterLase now has over 300 patents and patents pending around this whole area of laser dentistry and combining water and laser interaction.
Amazing. So what are the benefits of WaterLase laser dentistry over the traditional drill with a filling?
Well, as you know, drill with a filling means drill and needle, and those are the two things, if you ask anybody about the dentist, what don't you like?
Yeah.
The drill and the needle.
Absolutely.
And so using this WaterLase technology, we're able to eliminate both of those things. And using a drill, what most people don't understand is that it causes heat because of the friction, so heat causes pain, and it also does something else that most people don't know, and that causes what we as dentists call microfractures. And these are hundreds and hundreds of tiny little cracks in the tooth that people would understand this if they've ever had a sandwich or a soft salad or something like that and actually broken their tooth for no particular reason. We as dentists set these patients up for failure years before by using a drill, and then also by eliminating the needle, we're able to get rid of the pain associated with a dental appointment.
Wow, wow. Well, let's take a look at how this new technology works in this 21st Century Health Field Report.
The main reason people don't like to see the dentist is fear. Not fear of the dentist, fear of pain. Because drilling causes heat and vibration, there's pain to the patient and trauma to the tooth. Finally, there's an alternative. WaterLase dental lasers use patented YSGG laser energy combined with a comfortable air and water spray to perform many dental procedures without contact, heat, vibration, or pressure, which means little to no pain for patients.
When a patient has a procedure with a WaterLase, it changes the way they look at dentistry. They're an instant source of referrals. They have less pain, less shots, less swelling, and they really enjoy coming to the dentist. And because of that, they immediately go home, tell their spouse, tell their children, their friends, their extended family, and it really makes more patients want to come into the practice.
The standard dental drill causes pain. Shots to alleviate this pain result in numbed lips and cheeks that can last for hours after the visit. In addition, using the drill for dental procedures typically results in multiple visits needed to complete dental work. WaterLase eliminates these problems.
Sometimes with traditional dental procedures, patients didn't want to reappoint. They wanted to take a break, or because they had some problems with that visit, they didn't want to go for another visit. Now, because it's a much easier procedure, patients are more apt to reappoint afterwards.
Oh, it's a mild difference in terms of, comfort for the patient. I mean, I've gone under the scalpel and, the conventional drill, and the discomfort level is very high with that. And recuperating from, the procedure afterwards using conventional methods, it takes a while. It takes, a while for Novocaine to wear out. You can't eat, you can't do anything. And of course, recuperating from the actual procedure, it takes, weeks. With the WaterLase, I think, based on my experience, that it's going to be really, really quick.
Resulting in more satisfied patients and a different kind of dental care. WaterLase is beneficial for everyone, but especially children. With no fear of the dentist, kids and moms are more likely to make and keep regular visits.
You can barely feel a thing. It doesn't hurt at all. I like it. It feels comfortable and doesn't even hurt.
WaterLase is extremely versatile. It can be used for a wide range of hard and soft tissue procedures, from decay removal, cavity preparation, root canals, smile design, gum and bone surgical procedures, and many others. WaterLase provides greater accuracy, less bleeding and swelling, fewer dental visits, no cross-contamination risks, and a virtually pain-free experience for the patient. Happier patients with better dental care. Every dentist needs WaterLase.
I've been doing WaterLase dentistry for 8 years. It's changed the way I practice dentistry. It changed the way I look at my patients and the way my patients look at me. I would really recommend it to everyone.
That looks amazing, Dr. Walensky. So tell us, why should you choose a WaterLase dentist?
Well, a WaterLase dentist in general is a high-tech dentist, and a recent survey of patients showed that 100% of patients expect or even want their dentist to be a high-tech dentist. If they've invested in the WaterLase technology for your own safety and your comfort and for minimally invasive procedures, chances are they've also invested in other areas of the practice for your safety and convenience as well.
I would assume that patients are so used to lasers being used in other types of medical work that when it comes to dentistry, they're not that surprised by it anymore.
That's exactly right, because when I first started using this years ago, patients would start to ask me, why am I using a laser? But now you can't turn on a radio without hearing someone advertising LASIK surgery, and no one would even in their right mind would think about going to have some LASIK surgery done with a scalpel anymore. No. You'd have it done with a laser, and the same thing is true in dentistry these days.
What other common procedures are made more painless and safer through the use of the WaterLase?
Well, when we ask our owners, BioLase owners, what they use the laser for, most of them say they use the laser for almost every procedure every single day. So this goes not just for fillings. We can use this laser for endodontics, so root canal therapy, for third molar removal, for implant surgery. And actually, some things that you wouldn't maybe even be aware of is there's a growing trend for doing something called a frenectomy, that little piece of skin that's underneath the tongue where kids are tongue-tied. The procedure can be done painlessly without needles, without stitches in 5 to 10 minutes. And in other cases, we've had dentists who treated babies as young as about 3 days old who weren't able to nurse because of having a tongue tie, and you're able to do it again without anesthesia, without dangerous anesthesia at those levels, and without actually having to put sutures and anything in these poor little children that can't nurse.
Wow. And I understand that there's no blood when you use a laser in dentistry?
Well, there's no blood unless you want it there, but yeah, that's pretty much the case. WaterLase is not laser. Laser is only a component of WaterLase technology, and so what happens is that the laser energy combines with water, and this creates a very unique biological way of cutting tissue, and in doing so, we're not necessarily cauterizing and causing a lot of heat, but yes, it's a bloodless procedure for the most part.
Fascinating. How does WaterLase help with patients who are fearful of going to a dentist for their dental care?
Well, my gosh, most studies show that maybe half the population avoid the dentist because of fear. Whether it's rational, irrational, it's fear. And so what are the things that cause fear is pain, and what causes pain are needles and drills. And so if we can eliminate those things in our dental experience, all the better.
I've heard much about sedation dentistry, but not so much about the water combined with laser. It seems that in my community anyway, you either have regular dentistry or you are completely knocked out with a sedation type. This is something new.
It is, but there's also many of our customers are also sedation dentists. So even if the patient is sleeping or sedated, they're still able to get the benefits of using lasers, where the surgeries heal a lot faster and there's less swelling and less problems because they're minimally invasive treatments.
Wow. Amazing.
WaterLase is a unique company because it is real high tech in dentistry. We have introduced finally what high-tech dentistry should be, and we are changing the way that dentistry is practiced. Not many people know that the dental burr, the conventional dental burr, has been invented 9,000 years ago by the ancient Egyptians. And the only evolution in 9,000 years is that the dental burr now runs at a higher speed, and so we have the high-speed dental burr. But it's always a burr. It's always an instrument that grinds teeth, and grinding teeth means heat, means microfractures, means damaging the tooth, the structure of the tooth, damaging the nerve that is in the tooth, and also means the patient will have pain. The WaterLase technology that BioLase has invented and perfected allows for a whole new approach to dentistry.
The incorporation of the WaterLase into my practice has allowed me to provide procedures to my patients at a stage where it is less invasive for them. It allows me to do a lot of dentistry without having to give any anesthesia at all. One of the greatest advantages of having the WaterLase in the practice is that my patients receive less anesthetic for most procedures. In fact, there's a lot of procedures we don't even have to give anesthetic to get the job done. Especially in children, we are allowed to do removal of decay, treat the disease process with no shot, work in multiple quadrants at the same time, which allows us to get many procedures done, and the children aren't feeling any pain at all.
I also teach other dentists, and I've shown them that the return on income from having the WaterLase laser in their practice, they can see anywhere from a 3 to 4 to 5 to 1 return, because patients are talking more about their practice, patients are more enthusiastic about coming to the dental office, and the whole thing with treating patients is treating them painlessly so that they have a reason to return.
Our body is made of water, and the WaterLase acts on water molecules that get transformed into vapor, and that creates the ablation of the tissue. What a wonderful thing. No other surgical system does that. The blade, for instance, is very traumatic to the tissue. The burr is very traumatic to the tissue. Electric saws that are used in plastic surgery, the electrosurge is heat. So whatever instrument, surgical instrument we're looking at for surgery on human body and animal body, it is always traumatic. The WaterLase is the only one that is not, and is a brand new instrument, a brand new surgical instrument.
For the patient, what makes the procedure from WaterLase more efficient and comfortable for the patient over having the traditional shot and drill for a filling?
Well, Jackie, let's say that you go to your dentist and he tells you that you have a cavity here and here and here. Traditional dentistry says that you need to get this one numb, do the filling, and then you go home, because you can't be too numb if you're going to go back to work, or you have to be able to talk and you want to keep your job. So now you have to reappoint and come back for this one and then come back for that one. By not having to give the injection, now you can go to your dentist and have this, this, and this all done at the same appointment. And also, because you're not having to wait for the anesthetic, the appointment overall is a lot shorter. So you miss less work, it's a lot more comfortable, and you can eat immediately after you leave the office.
That's amazing. I don't see a downside to this. It's amazing.
Sorry.
What about for kids, children who start their dental care with the WaterLase versus, having procedures done with the traditional drill?
Well, contrary to popular belief, children aren't born with an inherent fear of the dentist. They hear from friends, they hear from family experiences about there's a needle that's 2 feet long, and so when I have a child in my chair, he's always looking around all over the place where the needle's coming from. And so if we can avoid that, we teach our dentists, our WaterLase dentists, the tell, show, and do method. So they explain the treatment to the child. They actually show it on their own finger and then on the child's finger. And then basically what I'll tell a child is that we're going to wash your tooth, because the only sensation that a patient has when we use the WaterLase is a water spray, a gentle water spray on the tooth, not the vibration, not any of the drill noise and all the other things that are associated traditionally. So it's a wonderful experience for the child, literally, and I can't tell you how many times that mom will come up to me and just say, "Oh my gosh, that's it? Like, why didn't we have this when I was little?" And then the next question they ask me is, do you accept adults as patients too? And it's
when can I get in?
Exactly.
Right. That is really amazing. So really the sensation, if a child is having a cavity filled, the sensation that they get instead of drilling is just water splashing over the tooth?
Yeah, the WaterLase is composed of 3 ingredients. One is air, one is water, and one is this unique wavelength of laser energy. And by combining those in a special way, the only thing you really feel is just a gentle room temperature water spray. It's very comfortable.
Can WaterLase be used to treat gum disease also?
Oh, absolutely. If you're familiar with traditional gum surgery, not to get too graphic, but a scalpel is used to separate the gum from the tooth and from the bone. It's peeled back. It's called a full thickness flap. And then all of that infected tissue is scraped out, and then using a drill, they recontour the bone and put either cow bone or cadaver bone in there. And then I told you, I'm sorry.
Sounds wonderful.
And then sew it back up. It takes literally a week, maybe 2 weeks sometimes, in order for you to feel back to normal again. whereas using the laser, the WaterLase, to do this procedure, it's very minimally invasive. The fiber is 1/50th of an inch in diameter, so it's a very, very small fiber that actually goes between the tooth and the gum and is able to kill the bacteria, because it's a well-known fact that laser energy will kill bacteria, which is the primary culprit in periodontal disease. And then in doing so, we don't create all of this open, horrible surgical areas. We don't need stitches. We do need to get the patient numb. That's the one drawback.
Right.
But healing, instead of 1 to 2 weeks, is literally 1 to 2 days.
Really? So there's not all the gum replacement and all of that?
No, and in fact, when I have patients come to me because they know that I have WaterLase technology in my office, a lot of them have only ever had one of their quadrants, 1/4 of their mouth treated with traditional periodontal surgery. And then they've said, you know what, I'd rather lose my teeth than have to go through that nonsense again.
Oh.
So a lot of the patients that I see, I end up only doing 3/4 of their mouth because the first quarter was such a horrible experience for them, unfortunately.
Huh, amazing.
So Eric, we're going to do your tooth today, okay? We're going to fill this cavity for you, and instead of using a drill, we're going to use the laser. It's going to use water to clean the tooth out, all right? So you're just going to get a lot of water in your mouth, and we'll be in good shape, all righty? Very good. Oh, this is going to be easy peasy lemon squeezy. The WaterLase increases my revenue stream in multiple different ways. Number one, I do more procedures on patients because they're more apt to do the work, because they're not in pain, they're not swollen, and they like dentistry more. Second, I do more dentistry by procedures that I never did before. So I get to add procedures like surgical procedures or cavity preparations without anesthesia. So it really changes how we practice dentistry, and it adds revenue by doing more procedures and getting more work done for the patients. Okay, chin up all the way to the ceiling. I give less shots to my patients. I use less scalpels, less swelling, less drills. Patients love it. They tell their friends. I do more procedures that I haven't done ever before. I've added to the practice. It's really changed the way I not only practice dentistry, but the way I look at my patients. So Courtney, Eric did great.
Great.
We did a cavity, we did the filling, no shot, no drill. He was amazing. What do you think about that? We can do this without a shot.
That's fabulous. The fact that I know I've had it with you before, and to be able to have Eric be able to have it without having the drills, especially being a special needs child. I know for myself, I don't like needles, and for him, it's huge.
Yeah, most parents don't want to put their kids under general anesthesia, so I'm glad we can offer this and provide him with treatment that's simple and easy and quick. So thank you for bringing him in.
Thank you so much.
Treating Eric was a really special thing. It's been wonderful using the WaterLase with special needs kids. It allows us to provide an alternative to traditional therapy that sometimes is very difficult for them. Whether it's sensory issues or other things, the WaterLase is much less invasive, less discomfort, less pain, and the patients do really well. It's a wonderful opportunity using the WaterLase to serve the community.
How does WaterLase prevent cross-contamination? I've heard it's actually cleaner than using traditional dental instruments.
It's absolutely cleaner. There was a recent study in Dentaltown that showed that dentists reuse 70% of their root canal instruments from patient to patient. Now that's important because the bacteria that you remove from the inside of a root canal is very serious bacteria. Couple that with the fact that another study that was published in the California Dental Association showed that even after proper protocol of cleaning your dental drill bits, 15% of them are still contaminated after autoclaving them. So in the past, if you got cross-contamination from another patient, maybe not so serious, but these days with antibiotic-resistant bacteria and very serious viruses, if you get a cross-contamination contagion, I mean, it could really be a serious thing. So a savvy patient needs to be aware of this to protect himself and his family and his loved ones, because this has been approved for adults all the way to children. And unlike a dental drill, the WaterLase tip doesn't actually come in contact with the tooth. It's non-contact. The only thing that touches the tooth is laser light. So you have absolutely no possibility of contaminating from patient to patient.
That makes sense.
Really, it does.
Huh. How is this more accurate and precise than traditional dental instruments like drills, scalpels, and electrosurge devices?
Well, if we look at the actual WaterLase tip, It's about half a millimeter in diameter. And to put that into perspective, there's over 25 millimeters in an inch. So we're talking about less than 1/50th of an inch in diameter for this. It's very, very precise. If you're comparing it to an electrosurge can be dangerous, which is why you have to actually ground your patient before you use it. You have to place a plate behind their back in order to use this, and you also have to stay away from anything metal. So any crowns, any bridge work, any implants, any orthodontics, the electrosurge will actually interact with that and cause sparking and all sorts of electrical arcs and things. So it's a lot more precise than that.
Sounds bad.
The WaterLase technology is great for the patient because the patient can enjoy no pain, better dentistry, healthy dentistry, no cross-contamination because dental burrs, they are used and reused in most of the cases from patient to patient. And that is a great danger to the health of the patient. WaterLase technology, because of the laser component, kills any bacteria and any virus. So it is extremely safe for us adults, for kids. We are also FDA approved for pediatric use. So plenty of advantages for patients also because not needing an anesthetic, a dentist can perform a surgery on both quadrants of the mouth, different quadrants of the mouth. The fact that we receive anesthetic on one side of the mouth doesn't allow the dentist to also give anesthetic on the other side of the mouth, otherwise we will be chewing off our tongue. So that means a second visit, and also to be numb for quite some time, few hours, and not being able to talk normally and function normally.
So the benefit of using the WaterLase laser is that I can eliminate anesthesia in many cases. I can convert from a soft tissue procedure to a hard tissue procedure back to the soft tissue procedure. It has allowed me to eliminate packing retraction cord in the preparation of crowns during the impression stage. And it has made the experiences of our patients totally different. It has excited patients because they can come in and have 1 through 4 fillings done without any anesthetic at all. Just recently, I had a mother call our office because she knew I had a WaterLase laser in my practice. She came to me from her other dentist to me to have me do fillings on her son. And he came in a little nervous, and we did 5 fillings for him, no Novocaine at all, and he was thrilled. In fact, how that was so great was then a month later, she brought back her daughter who also needed fillings, and the only place she was gonna go was to our office. And she was ecstatic and appreciative and grateful that we could treat her children without anesthetic, and we used the laser. And the kids had a great time because it kind of sounds like a helicopter's coming down and treating the tooth, because that's what it kind of sounds like, versus the high shrill of a drill that scares a lot of children.
It's good for the dentist also because it allows the dentist now not to have these patients requiring very early morning appointments or late afternoon appointments. He can spread them during the day. He doesn't have to give an anesthetic, so he has no downtime. He has no cost of anesthetic. Many patients, by the way, they are allergic to anesthetic.
If you don't have a WaterLase in your practice, you're losing money out the door every day. Whether or not you're referring things that you could actually do with the WaterLase, whether or not you could be doing multiple appointments at this, in the same visit. I mean, just all the things you can do. Having this technology in your practice is amazing.
Are dentists adopting this? Is this hard for dentists to learn how to use this?
It's not very hard to learn how to use. It's just, I think it goes back to not just dentists, but people in general are resistant to change. It also doesn't cost any more. When you go to your dentist who has a WaterLase, they bill you for a filling, or they'll bill you for gum surgery, not for a laser filling or a laser gum surgery, so the cost to the patient is identical.
And as far as insurance billing purposes, if the cost to the patient is identical, it sounds like it would be the same for the insurance companies.
Exactly right.
What is the best way for a patient to find a WaterLase dentist in their area? Because the way you're describing it, it sounds like anyone who goes to the dentist would rather have this.
Well, you can find a WaterLase dentist at home in your underwear, as they say. You can just go online, and there's a website called WaterLase.com. Put your zip code in, and you can find all the dentists in your area who have adopted the WaterLase technology.
Wow. And Dr. Walensky, what do you see ahead in the future of WaterLase?
Well, the ultimate goal is to have WaterLase dentistry be the standard of care in all areas of dentistry. Because of the minimally invasive procedures and the safety, it just makes sense. And one thing you can count on is that BioLase will be at the forefront of any medical laser developments, because we're expanding into ophthalmology and dermatology and even orthopedics.
Incredible. Well, it's wonderful to hear that there's finally a legitimate alternative to the dreaded shot and drill for dental procedures. So thank you for sharing this amazing technology with us. It's fascinating.
Thanks so much, Jackie.
And thank you for watching. For 21st Century Health, I'm Jackie Bales.